Hi, I'm Dr. Mark Jabor from Cosmetic Surgery and Laser Center of El Paso. Today we're going to be performing an upper blepharoplasty and a lower blepharoplasty. To begin with, we'll be performing a lower blepharoplasty. This particular type of blepharoplasty will be an incision will be made inside the eyelid, so there'll be no external incision on the skin. From there, the fat pockets will be removed and the incision closed. In this way, we don't stand the risk of weakening the support to the lower eyelid and the potential of a patient developing problems in the future. For the upper eyelid, it'll be a little bit more straightforward. It'll be a direct skin excision and possibly a small amount of fat, but most likely just skin. So the patient is already on the table, has been injected with local anesthesia, and this is done with oral sedation and local anesthesia. So we'll be getting started, and we'll come back in just a little bit. Thank you. Lower eyelid, and we've done some dissection, and here kind of popping out is this fat bags that the patient has. So we'll remove this, and so we're back. We went ahead and removed the skin from the upper eyelid, as you can see here in this elliptical type of fashion. Next thing we'll do is we'll bring these two edges back together and close. Also, note the fat has already been removed from this lower eyelid here, and you can see how much smoother that is. Took a significant amount of fat out. At the end, I can show you both the skin and the fat that was removed. We'll also remove a tiny bit of fat right here in the medial compartment of the upper eyelid. But we're close to being finished here. After we do that, we're going to close and we'll pretty much be done. See, it was excision of skin and a slight amount of fat in the most inner portion of the eye. And then on the lower blepharoplasty, there was fat removed, but the incision was done on the inside, so there's no incision on the outside. Some of this blue that you see here is the marker that we used. So the patient, again, this was under local anesthesia with oral sedation. Tolerated procedure well. You can see here, this is skin and the fat that was removed from both sides. So, typical type of procedure that we perform in the office under local anesthesia. This is Mark Jabor with Cosmetic Surgery and Laser Center of El Paso. Thank you for watching.